welcome to Talking Points with Preferred Health Magazine. I'm Nancy Gregory. Joining me in conversation is Dr. Laila Rashidi, an esteemed colorectal surgeon serving Tacoma and surrounding communities. She is associated with Multicare's colon and rectal surgery. Dr. Rashidi serves as the program director for the National Accreditation Program for Rectal Cancer, director for the Surgical Oncology, and is a program director of the Minimally Invasive Surgery Fellowship at Multicare Health System. Dr. Rashidi, you're a very busy surgeon. Welcome. We appreciate you joining us.
Thank you so much, Nancy. Great to be here.
I'm going to start with a question we like to ask all of our guests. How close are you to what your younger self wanted to be?
That's a great question. I think, you always want more, right? And my path went so different ways. I kind of envisioned myself to be a physician. I didn't know I wanted to be a surgeon at that time. But as I move forward, I get more excited about it. And when I look back, I'm like, well, I'm getting closer. We're not there yet, but close.
Well, in fact, you first graduated with a degree in engineering from the University of Tehran. What inspired you to transition from engineering to medicine, particularly colorectal surgery?
That's why I say our path is never straight. I always actually wanted to be a doctor, from childhood. I used to wear, doctor clothes and act like it. And I was exposed, from my childhood year to family members that were sick. So kind of made the passion to become a doctor to help people. I lived in Iran and it's just a very different, environment. And, I had an amazing family, but traditional. And I remember when I finished high school, I actually wanted to come to US to pursue med school and, kind of go through the path of becoming a physician. I remember my parents told me, well, you got to take the entrance exam, at least show us you can get to a university in Iran, and then we'll talk about, sending you to US. And I, took the exam and I got accepted to a very prestigious university. It's called University of Tehran in engineering field. And it's a government, university, which pretty much pays for you. It's like getting a scholarship. And I remember, my dad said, who would leave, the engineering, this university and then go do medicine? So I had to change my route. I still wanted to do it. So, but one of the criteria was that, I had to stay and go to university. So I got my degree. And during that path, I did a lot of things to kind of lead me to come to US and pursue medical school.
So, even with medical school and colorectal surgery, what led you to decide to specialize in robotic assisted colorectal surgery?
I think, once you go through the path of medicine and surgery, you always want to see how you can get better, how you can improve, and how you can do things that, can benefit your patients. So, when I finished my, residency year, I was a good open surgeon. And at that time, we did a lot of laparoscopic surgery, which I thought laparoscopic is a great tool. It's less invasive for our patients. And then the robotic came. And, I sat and saw, and I was like, this is a much better tool, for the patients with their outcome. And I got attracted to it because I feel we always have to get better and do better and improve our skills. So that's where I really started, my fellowship. I did quite a bit of robotic surgery. And when I started my practice, I'm like, if I want to do the best, I have to choose the tool that gives the best. And that's where I focus on robotics. And now almost 100% of my practice is robotic surgery.
100% almost.
Yeah, even our emergency cases,
Wow.
which is
Yeah. Can you walk us through how robotic assisted surgery differs from the traditional laparoscopic or open procedures, as you mentioned, in treating colorectal conditions?
Yeah, colorectal in general, it's a complex disease. It's never the same. And I think that's why I love this field because there's so many, diseases and there's so many conditions. And when you enter someone's abdomen, it's never the same thing, but it's complex. So for me, the way I kind of approached it, and the differences was laparoscopic, you have straight sticks and you're dependent to your assistant to holding the camera and moving things around. And when you're in narrow places like the pelvis, for a rectal cancer or very complex cases with cancer or complex benign disease, with a straight stick, sometimes can be very challenging, to perform those cases. But with robotics, you have 360-degree articulation. Even the things that you cannot do with your own hands, but with this tool you can do. You can get to the most narrow place with excellent visualization, the precision. And I feel all of those are very important because there's a lot of structures we need to watch and make sure that, we save during the operation. Um, and that's what, this tool allows you to do very, very complex cases with just 4 small little cuts. And when you see your patient the next day walking, eating, and getting out of the hospital, or even leaving sometimes the same day, that's pretty awesome and valuable for me.
The same day.
Yeah, we've been doing quite a bit of same day discharge for colorectal surgery in selected patients. Yeah.
That's
We
amazing.
came from 10 to 12 days to 4 to 5 days. Now, average length of stay for colorectal resection is about 3 to 4 days, and we do either same day or next day.
So, with that said, how has the field evolved since you started?
We've been seeing, I mean, it's still evolving. Patients used to be admitted to the hospital, get bowel prep. We used to do open surgery or even laparoscopic, make it open, make our incision bigger, bring the bowel out, do our connection. And patient used to stay because it's a lot more trauma. They used to stay, a couple of days in the hospital. Now, we do everything inside the abdomen. Our incisions are maybe, depending to the tumor size or the disease, but usually it's about max 3 centimeter just to get the colon out. And we do our connection, everything inside the abdomen. So there is very minimal trauma, not much of, what we call kind of force on tissues, while we're performing these cases. So therefore, inflammation is less and patient do better, less pain. They eat pretty much same day and they recover faster.
Well, you also lead a robotic colorectal case observation training center. What what skills are most critical for surgeons learning robotic techniques?
I think it's very important. We all go through our learning curves. I always tell the surgeons, I'm like, I went through the same thing. All of us do. Number one is patience. Anytime you want to learn something, you have to be patient. You have to be persistent in what you want to do. If you really want to learn it, you got to put time for it. You can't just do one case and the next one will be next month. You have to do the repetition in anything, in not just robotics. And I think you have to have structure. You have to communicate with your team. I think, surgery is a sport, is a team sport. So you got all your team member. You have to communicate, you have to collaborate to make it successful. And you need to put structure for yourself of what you want to do with the case and be patient. And, I think that's pretty much, I always say I'm no one special, right? We all went through the same path, but I think it was just that structure that kind of got me, to a point that now we pretty much do any case, minimally invasively.
What are some of the biggest misconceptions patients and perhaps even some physicians have about robotic surgery?
I think from a patient standpoint, sometimes if they don't know what robotic is, they're like, what, a robot is going to operate on me? And I'm like, no, robot is a tool that, us as surgeon use. And it's an amazing tool that let us do very complex things in a very minimal invasive fashion, but we control it. Us as surgeon control what we do. Just, we put our, face and hand in our console. We dance, I say, and it transmits to what we do, inside the abdomen with patients. It's an art. Literally you're doing a good artistic work, for your patient. So that's the misconception. Mostly I have, what my patients think from other surgeons and maybe healthcare, that it may be more expensive or it takes a long time, or is it worth utilizing compared to other modality? And I think the first question you have to ask is this tool making a difference in your practice? If it does, then yes, you have to advocate for it. And if you see the benefit, prove it. Prove it with your outcomes and what you do for your patients. And as far as, the misconception of time, I'll tell you, I'm much faster now doing robotic cases than laparoscopic, but it was that repetition and practice that I've been doing.
Repetition is everything, it sounds like.
Yes, in anything,
And
not just
anything.
surgery.
Yes.
You want to be a marathon runner, you got to practice, you got to put time for it. And it's that, doing that everyday practice, putting structure for yourself. Surgery is the same thing.
For our audience, can you explain the conditions that you treat?
Yeah, so as a colorectal surgeon, we do pretty much, I call it anything past the diaphragm. So we treat colorectal cancer, anal cancer, benign disease like diverticulitis, inflammatory bowel disease like Crohn's, ulcerative colitis, anal rectal like hemorrhoid, fistulas, fissure. My passion is mostly colorectal cancer and complex benign disease or malignant disease. That's, where I kind of see a lot of, the changes that in the field of surgery has happened. And it's very exciting to see where we're moving, forward.
What are some of the symptoms of colorectal disease, and how can a patient actually tell when it's time to be checked?
That's a great question. Actually, March is coming, which is the Colorectal Cancer Awareness Month. I always tell my patient, colorectal disease, especially cancer, doesn't knock on your door. So I always say, listen to your body. See what's norm for you. If you see, most common for colorectal cancer, change in bowel habits. You had normal stool caliber, now it's, let's say, thinner, or things just don't right. Abdomen, gets distended just after, like, let's say, eating. Bleeding, don't always think it's hemorrhoids, it could be something more serious. But the three common things, it's, weight loss without a reason, change in your stool caliber, and blood in your stool. Those are the three big ones you want to pay attention to.
Does lifestyle choice impact colorectal health?
Absolutely. Just like anything, I believe healthy living, it's important, but some of the things for colorectal cancer has been seen as, diet, processed food and red meat are not good. Sedentary lifestyle is not good. Um, Smoking, excessive alcohol consumption. Those are some of the big factors, you want to pay attention to. So we always talk about high fiber diet, less processed food, activity, exercise, hydration, less smoking, drinking, all of those important to have a good and healthy colorectal uh,
Health, yeah, it's really important. With colorectal cases, I understand that there's the statistics that says that it's rising among young adults. What preventative measures should people be taking?
we're seeing a lot in young patients. Even though we changed the guidelines for screening colonoscopy. Before we used to screen at the age of 50, now it's 45. I'll be honest with you, I think it still needs to be lower. I see patients less than 40 in their 30s, with colorectal cancer. And one of the big things I always tell my patients, even, primary care, because they're the one who sees their patients first, is, any changes like we talked about in their bowel movements or blood in a stool, pay more attention. Don't always attribute it to a benign process. Get your colonoscopy to make sure there's nothing bad in the, colon. But things that we talked about, diet is super important. Unfortunately, with our busy lifestyle, sometimes we want to go the easy route and eat a lot of processed food. It's not good. And I think unfortunately, we haven't been able to figure out exactly what it is that leads to colorectal cancer in young population. It's not always genetics or immediate family member that's led to it, but environment, diet, all of those are important.
You are tuned into Talking Points with Preferred Health Magazine. We are speaking with colorectal surgeon Dr. Laila Rashidi.
And, have a healthier lifestyle.
I'd like to touch a little bit more on your journey. As a woman growing up in the Middle East, what were some of the challenges you faced in pursuing your path in medicine?
It's, as a woman in Middle East, unfortunately, at least my time, it's getting better. We just did not have, a lot of the rights that, our male counterpart had. There was always a lot of bias on things that you wanted to do. We were limited, in society for educational purposes. So it wasn't as easy to pursue what you wanted. The gender discrimination, unfortunately, was more common than, what you see here. Cultural differences, I always joke, a woman at my age or younger than me, I would say, the expectation, you get married, you have children, that's the norm. Like saying, oh, I'm going to med school and I want to do surgery, kind of wasn't the answer a lot of the family members wanted to, hear. But it's changing. But I would say the stereotype, the bias, unfortunately, workplace environment for male versus female it's very, very different.
I understand that you were motivated to establish Women in Northwest Surgery, or WINS, in 2019. And how has that impacted female surgeons from your perspective?
I think it's really good to have some sort of a source for mentorship and sponsorship. I always, I was very lucky, when I came, to US, I met a lot of great people, men and women, who helped me through my path. And it was not a straight path. And I always, especially for the field of surgery, we didn't have these groups, for that mentorship and sponsorship. And I feel it's important. It's important, because we experienced all of this, to have something for the future, for the future female surgeons that are coming up, lifting them up, kind of leveling them up, as we say. So actually, with one of my friends, Eileen Wong, who's a general surgeon, we're like, let's make something, because there is actually a great hepatobiliary surgeon who's my friend, Sharona Ross. She did this huge thing for Women in Surgery Career Symposium, and I go there every year. And you could see the effect that has in young, from pre-med to college student to, so you're exposing them from a young years, showing that what is surgery? It's not always a male dominant field, right? You can own your place. And we said, why not do something, in a smaller scale, but within Northwest? And it was a great, place to meet other female surgeons, invite residents, students, and just, talk about, matters that we usually don't talk about at, national meetings or scientific meeting. And it was very impactful. I got to, meet a lot of new people that I haven't met. We got a lot of, residents and students in, and that form kind of that mentorship and the relations that now they come rotate with us. We help them during their path. I always, thought it's, from if it was me that time, I would want it to have this. So why not, do something to, give to our future, hopefully, female surgeon out there.
Absolutely. What does being named patient preferred surgeon and being among the empowered women in medicine mean to you?
I think it's very rewarding, and I'm honored. I think a lot of people are, at that stage, but I'm very privileged to be named that. And I think, what it means is, when kind of empowered woman or preferred health woman, I think it's the confidence and support and opportunities, that you give to excel, hopefully to lead and innovate within healthcare and also within your community. It's opening kind of the eyes, having a voice, and giving others, the voice, and collaboration, and working with your colleagues. So I think I'm very lucky because I had great colleagues, great mentors, and who kind of put me through this path. And I want to do what is best for the patients, but also within our own, medical and surgical society.
I'm definitely passionate about this. What advice do you have for women pursuing careers in surgery, particularly historically male-dominated specialties?
I think one of the most important things I want to, tell our, the future surgeons or, female surgeons, kind of, own your place in the room. This just didn't, happen. Let your work, speak for yourself, your skills, and build that strong, support system. It's important that, you speak with your actions. And if you're there, you already did the hard work, right? It's not male and female, I know we talk about it, but we're all equal, right? And it's what you have done. It's what brought you, to that room or to this field. So own it, own it, advocate for yourself. It's really important, to ask for what you want. What's the worst answer you hear? It's a no. And you may fight for it, but believe in yourself, advocate for yourself, ask for things that you want, and let your actions speak up for what you do. I see a lot of people that have so much potential, but they may be a little shy, right? They may not be out there. But I love to empower them to say, if you don't ask for it, unfortunately, you may not, get what you want.
A message do you have for aspiring surgeons, particularly those who are interested in colorectal surgery?
Well, I'm a little biased because I love colorectal surgery. I say it's the best field, right? No, yes. I'm kidding. But my message is, if you have a passion for surgery, or colorectal is a great field, especially for, women. You treat a lot of diseases, you do from very simple cases to very, very complex cases. You have technology and innovation that you implement, for your patients. You touch on them, you see your result. And at each stage of your life, there is what I say, a procedure that you can do, as a colorectal. But if you really want it, don't give up, work hard for it. It's actually a very competitive field. But, with hard work, resilience, and, vision and dedication, you can definitely, get to this field.
At the bedside, you've treated hundreds of patients who not only praise your expertise, but your compassion. How do you build a strong doctor-patient relationship in such a specialized field?
Well, number one, I think you need to treat all your patients like your own family member. I don't discriminate. No, I think you should not discriminate based on who they are, socioeconomic, gender, none of that. They are like a family member. And if you feel they're like a family member, then you have passion for it and you will do anything for it. My patients, I always tell them, I said, we are a team. You are my team member.
Mm-hmm.
When we're going into that OR, when we sit and talk about things, I say, listen, surgery or just in general, medicine is a sport. There's a lot of people involved. We're all your team member. And guess who's the center of this team? It's the patient. And they have the power. So I tell them, you're the final decision maker and you say what we need to do. I can just tell you what I think. So I think if we work as a team, we can beat anything. It's just like we talked about that collaboration and how we work to push something to reach what we need. It's the same with the patient. And empowering your patient is very important because it is their life and we just have to work together. So I think that's why I feel I have knock on wood, I have a good relation with all my patients, but I think because I respect them. I respect them, I treat them like my family member, and I empower them. And I think that's very important.
Absolutely. What recent advancements in colorectal cancer treatment excite you the most?
I think from a surgeon, there's a lot, we talked about oncology, all the new drugs, but I think the technology, it's so great that you could do right now we're doing single port for some of our, colorectal disease, including cancer patient. That means you make one little incision and you can do the entire surgery through one little incision. Or, or single port intraluminal. So, we're able to go inside the lumen of the rectum and lower colon and do procedures. So that innovation and, technology to do less invasive operation, I think is pretty amazing.
What do you want people to know who are diagnosed or will be diagnosed about the field, and what do you want them to know?
I want them to know that, if I tell you don't be scared, I'd be lying. All of us are going to be scared at the beginning. But I want to say that, we've advanced. We advanced quite a bit, and it's not as scary as it was. At least, I always ask my patients, and they tell me, oh my God, it wasn't like what I thought. Because, you have to make things simpler. Yes, we have a bad condition, but how can we make it easier? And I think we're at a great spot and the future is bright because that innovation and technology is improving. We've already improved and we're improving even more. So it's not as bad as we think. You may have a very bad disease, but if with 4, max 5 small little cuts, you're able to take care of that problem, get out of the hospital next day, get back to your work faster, get to your chemotherapy faster. These are all, advancement. And, colorectal, I would say, is one of those fields that we advance quite a bit. So it's exciting time.
Haven't been diagnosed or anything, but the message that you sent was very comforting to know with the advancements and everything that it can be a scary time, but technology and experts like yourself are on our side.
Well, good. I'm glad you felt that way.
Oh, good. Thank you. It was a pleasure.
Thank you. Have a good
Okay.
one.
You too. Bye-bye.